Hello, my name is Gavras Lassi. I am fourth-year nuclear medicine registrar from Stellenbosch University. The title of our research was the relationship between bone marrow involvement on FDG PET-CT and bone marrow biopsy in patients with multiple myeloma. So to start with, what is multiple myeloma? As you can see in this animation video, multiple myeloma is a plasma cell neoplasm which is characterized by unregulated monoclonal proliferation of these malignant plasma cells within the bone marrow. Then these malignant plasma cells produce abnormal proteins called the monoclonal proteins and light chains, which causes end organ damage. So why are we interested in this topic? Our main reason was due to the absence of standardized PET-CT interpretation criteria in myelomas. There is limited uniform information regarding the role of FDG PET-CT in myeloma and particularly its relationship with bone marrow biopsy in assessing marrow involvement. Therefore, we perform a cross-sectional retrospective study. From a total of 190 patients with multiple myeloma, we recruited 103 patients based on our inclusion criteria, and 87 patients were excluded based on our exclusion criteria. For PET-CT interpretation, we use a visual criteria. So based on the potential effect on the bone marrow biopsy result, 3 patterns of FDG uptake were used, as you can see in this image. Those are uptake diffuse greater than liver, irregular uptake, and uptake diffuse less than or equals to liver. And PET-CT was considered to be positive for marrow involvement if the uptake pattern is diffuse greater than liver or irregular, and negative for marrow involvement if the uptake pattern is diffuse less than or equals to liver. And regarding the percentage plasma cell bone marrow infiltration data, it was collected both from the consolidated report of bone marrow aspiration and bone marrow biopsy results. Coming to our main results, as you can see in this box plot, which shows the median percentage of plasma cell bone marrow infiltration across the 3 described patterns of FDG uptake, our results showed that those patients with uptake pattern of diffuse greater than liver demonstrates the highest percentage plasma cell bone marrow infiltration with a median value of 85%, followed by those patients with irregular pattern of FDG uptake with a median value of 23%, and the lowest percentage plasma cell bone marrow infiltration was demonstrated in those patients with uptake diffuse less than or equals to liver with a median value of 8%. And in addition to that, our results showed that all patients with uptake pattern of diffuse greater than liver demonstrates a percentage plasma cell bone marrow infiltration of greater than 60%, and majority of the patients with uptake pattern of diffuse less than or equals to liver demonstrates percentage plasma cell bone marrow infiltration of less than 10%. However, in a patient with irregular pattern of FDG uptake, the percentage plasma cell bone marrow infiltration was quite heterogeneous, which ranges from as low as less than 10% to as high as greater than 60%. This is probably due to the risk of unrepresentative sampling in those particular patients. So our conclusions were diffusely hypermetabolic bone marrow on PET-CT corresponds to the highest percentage plasma cell bone marrow infiltration. Number 2, diffuse marrow that is not hypermetabolic corresponds to significant lower plasma cell bone marrow infiltration, but it doesn't reliably predict a negative bone marrow biopsy results. Number 3, in a patient with irregular hypermetabolic bone marrow on PET-CT, reliance on bone marrow biopsy alone may result in underestimation of the percentage plasma cell bone marrow infiltration, which could affect the patient management. Thank you very much.